Good morning. Welcome. My name is Qing Li. I'd like to thank the conference committee for the invitation. I also would like to thank co-authors in a manuscript with Journal Nursing Management. The title is Preventing Intimate Partner Violence Among Foreign-Born Latinx Mothers Through Relationship Education in Nurse Home Visiting. We have 4 learning objectives. Foreign-born Latinx mothers are vulnerable yet underserved to prevent intimate partner violence (IPV). Our solution is to strengthen social bonds and commitment through relationship education and explored role in home visiting. Our secondary analysis of trial show a diminished nativity gap in IPV among foreign-born Latinx mothers compared to US-born counterparts. We discuss implications for early prevention of IPV in federal home visiting program and inform program improvements. Early home visiting has been available for more than a century in Europe and the US. The concept is very simple. A trained person visits new parents at home for screening, case management, family counseling, and training. Pioneers include Henry Kemp, David Oates, and others. Early home visiting is a service delivery model, an evidence-based preventive intervention, and a vital health promotion strategies for vulnerable families. 19 models in maternal infant early childhood home visiting program, McVie, have been founded. Small funding have been provided to tribal initiatives. Nurse Family Partnership (NFP) is a model of early home visiting based on 3 theoretic foundations: attachment, human ecology, and self-efficacy. NFP program has achieved sustainable positive impact on maternal and child health outcomes. However, for challenging issues such as IPV, NFP program has been piloting testing new elements for innovation. Here is the definition for IPV. Actual or threat, physical, sexual violence, psychological, emotional abuse direct towards spouse, actual spouse, current former boyfriend, girlfriend, or dating partner. Effective prevention of IPV needs to consider context, early and upstream protective factors for an ecological framework. Relationship education is associated with reduced likelihood of IPV and dating violence. It has been recognized as an evidence-based practice by the National Center for Injury Prevention Control. However, huge gaps remain in implementing relationship education, especially in early home visiting. Only one data set available in the federal trial. In a study of McVie participants, 26% reported IPV. IPV is common but unresolved barriers. NFP study report 48% of reduction in child maltreatment. However, this important protective prevention effect disappeared in mothers with high level of IPV. To address this gap, 2 randomized control trials augmented IPV components into NFP program, but neither found significant effects. This time, we seized the opportunity to study Latinx mothers who were predominantly in the federal trial and the Czech trial. So 50% of the participants in the federal trial were Latinx mothers. More importantly, foreign-born Latinx mothers are vulnerable to IPV. Latinx mothers are quite common in early home visiting. In that early study, 37% of participants of the studied in McVie program were Latinx mothers, and 25% were Mexican. In Latinx community, machismo and marinosoma were cultural norms which encourage men to be dominant, women to be submissive. In a study in Florida, the Latinx mothers experienced social isolation, economic hardship, mistrust, and barrier to health and social services. Those undocumented are more vulnerable to IPV because they are more isolated, fear deportation, experience limited language proficiency, and a lack of strong support networks. However, immigrant Latinx mothers have been underserved in early home visiting. This review on IPV in group format in immigrant Latinos identified 10 publications, all outside home visiting setting, with positive impact on depression and self-esteem. I couldn't find there much detail on IPV. The authors recommend the use of Spanish language, cultural consideration, and culturally tailored topics such as gender norm, family and community unit, and access to legal protection. In this area, only one study protocol has been published on addressing IPV in early home visiting. It's based on self-care, comparing the parenting curriculum plus healthy relationship curriculum to reduce IPV and child maltreatment. I cannot find the detail in the healthy relationship curriculum. This is the photos for Jack Try. It didn't include comprehensive relationship education. The Feather Try did include comprehensive relationship education, were directed by Nanette Feather from criminology and Jacqueline Campbell from nursing. They were funded by National Center for Injury Prevention Control. Among 3 publications, the most recent one were published in 2018, were the only one analyzed the data. Nanette Feather has been battling with breast cancer. I signed a data use agreement with them and formed a transdisciplinary translational team. We applied epidemiology and integrated concept and practice from criminology, adolescent medicine, and family psychology, in addition to nursing, human development, and family studies, and maternal child health. Our objective was to examine the effectiveness of augmented home visiting program to prevent IPV among foreign-born Latinx mothers compared to US-born counterparts. We hypothesized that the life trajectory of foreign-born and US-born Latinx mothers could affect their response to IPV program differently. An important early study was on parenting dating violence. It contributed the mechanism of change because relationship education include teaching components on concept commitment and skill sets for future oriented decision to increase social bond and commitment, therefore disrupt the path from relationship instability to parenting dating violence. Among 63 teen mothers aged 15 to 17, we found significant program effect to reduce parenting dating violence at year 1 follow-up, but not at 2-year follow-up. This study is currently under review with family relations. We modified previous mechanism of change and to propose an integrated conceptual model to study the Latinx mothers. So we focus on nativity, how the US-born and foreign-born Latinx mothers differ. This integrated conceptual model includes two components. The first, intersectionality framework, the second, ecological framework. So this model was adapted from our manuscript under review and the work on IPV in Latin American women in Toronto. Based on intersectionality framework, the ethnicity and gender and nativity intersect at macro level of individual immigrants' experience to reflect multiple interlocking system of privilege and oppression at the macro social structure level, such as racism. Nancy Landale and Colley focus on how foreign-born status intersect with and mutually reinforce discrimination on the life course. This time, we focus on maternal response to IPV intervention. The ecological framework emphasizes the context environment. We perform secondary data analysis of randomized controlled trial in Oregon. First 10 low-income mothers were recruited to Nurse Family Partnership Program and randomized into Group 1 standard program, Group 2 augmented program. So nurses were trained and to provide IPV screening, refer to services, and most importantly, primary prevention through within my reach curriculum to Latinx mothers. This curriculum has been part of the Prevention Relationship Education Program, an evidence-based preventive intervention which reduced the family distress and partner violence in military families and other high-risk populations. So the earliest publication was in 1993. Those 15 sessions, nurses were trained and taught mothers the concept of commitment in relationship, sliding versus deciding, smart communication, speaker-listener technique, and making tough decisions in the federal trial. So those 15 sessions were tailored to 4 visits and a one-on-one setting by CDC officer Phyllis Norman, Daniel Whitaker, and original curriculum developer Scott Stanley, Galina Roth, worked with the team to ensure fidelity of the delivery of this curriculum. This 40-year scholar team from family psychology has been led by Howard Markman. Recently, they published the best practice in relationship education focused on intimate relations. The outcome variable, IPV, was assessed by research assistants at 3 visits during pregnancy, 1 year, and 2-year follow-up. Using revised conflict detect scale, they measured the physical sexual victimization, so there are 2 forms, and the physical sexual perpetrations, another 2 forms. So we code IPV as ordinal outcome. Sum those forms together range from 0 to 4. Well, we performed proportional odds model of generalized estimation equation, GEE. We also code it as a binary outcome. Absent of any form of violence indicate violent-free status, so we performed generalized estimation equation. Mothers were recruited from Latinx, African American, and Native American communities. In the console diagram, 238 mothers were interviewed, and the study achieved high retention rates, 80% at year 2 follow-up. This descriptive analysis of the full sample, 238 mothers. 119 mothers were Latinx mothers, including 86 foreign-born mothers and 33 US-born mothers. Compared to those US-born mothers, foreign-born mothers were more likely to report being older, with low education for age, with low family yearly income, being more likely to be employed, and more likely to report violent-free status, and few IPV forms. However, the trend is pretty consistent change over times. So for the foreign-born mothers in the augmented program, the violent-free status decreased from 76% at baseline, 55 year 1 follow-up, and 45% year 2 follow-up. The violent form increased from 0.4 to 0.7 year 1 follow-up, 0.8 year 2 follow-up. However, the foreign-born mothers in the augmented program report reduced violent form over time, 0.13 at baseline, 0.11 at year 1 follow-up, 0.9 at year 2 follow-up. Here shows result of multivariate analysis. On the left-hand column was the finding for the model 1, the ordinal outcome. So compared to the standard program, mothers in the augmented program report few violent forms, 0.38, and compared to US-born Latinx mothers, foreign-born mothers were likely report few IPV forms. The adjusted odds ratio 0.29, 95% confidence interval 0.13 to 0.67 were significant at baseline, and marginal significant at 1 year follow-up 0.43, not significant anymore at 2 year follow-up 0.75. This adjusted for age and education. The finding for binary outcome was different. We found foreign-born and US-born Latinx mother differed. The foreign-born Latinx mother report few IPV forms at baseline. This advantage attenuated at year 1 follow-up and disappeared at year 2 follow-up. Potential explanations include initial reporting bias or low effectiveness of the augmented program to foreign-born Latinx mothers. Our findings indicate the needs for culturally tailored programs. The study strengths include 1 year and 2 year follow-up after intervention. There are several study limitations. We face small sample size and missing data. Our study was not a prior subgroup analysis. We didn't have details on maternal nurse racial ethnic concurrence and language speaking matching. However, in personal communication, we learned nurses use Spanish soap opera that women watched to explain relationship concept. This study contributed important findings and resource for public health practice. For example, universal relationship education was assessed but not standardized at Maternal Child Health Bureau funded Home Visiting Collaborative Improvement Innovation Network. This study addressed this gap. We had important finding and resource on a standardized relationship education within my rich curriculum from family psychology. We learned the needs to understand mechanism, quantify inequality, and identify strategies to eliminate those barriers. Leaders in nursing and public health practice should support home visiting practice and research on culturally tailored programs to prevent IPV. Large transdisciplinary studies are needed to adapt and pilot test relationship education, address implementation issues, and design culturally tailored models for Latinx families. In conclusion, based on secondary data analysis of randomized control trial, foreign-born Latinx mothers report fewer forms of IPV than their US-born counterparts at baseline. The nativity gap diminished over time after the prevention program. The study findings inform future studies. Here are selected references. I'd like to acknowledge mentors, federal officers, funding from the Slate Community Scholars, and the past funding support. Thank you. Any questions and comments?